Hello everyone, welcome back to the channel. Today we're going to talk about one of the most important topics in pharmacokinetics, absorption of drugs. So, what exactly is absorption? Absorption is the movement of a drug from its site of administration into the systemic circulation, that is, into the bloodstream. Basically, once you give a drug, whether it's a tablet, an injection, or any other form, it needs to reach the blood before it can act anywhere in the body. That process of reaching the blood is called absorption. Now let's talk about how drugs actually get absorbed. There are four main mechanisms. The first and most common one is passive diffusion. In passive diffusion, the drug simply moves from an area of high concentration to an area of low concentration. No energy is required for this process. And remember, drugs that are lipid-soluble and non-ionized cross membranes much more easily by this method. The second mechanism is facilitated diffusion. This is also a passive process, meaning no energy is used. But here, a carrier protein helps the drug move across the membrane, still along the concentration gradient. The third one is active transport. Unlike the first two, this one does require energy, in the form of ATP. And interestingly, active transport can move a drug against its concentration gradient, from low to high concentration. It's also a saturable process, meaning if all the carriers are occupied, the transport can't go any faster. And the fourth mechanism is pinocytosis, where the cell actually engulfs the drug particle. This is how we absorb some large molecules, and also fat-soluble vitamins like A, D, E, and K. Now, several factors affect how well and how fast a drug gets absorbed. The first one, and a very important one for your exams, is pH and ionization, based on the Henderson-Hasselbalch principle. Here's the key idea. The non-ionized form of a drug is more lipid-soluble, so it crosses membranes and gets absorbed more easily than the ionized form. So, weak acids get absorbed better in an acidic environment, like the stomach. And weak bases get absorbed better in an alkaline environment, like the intestine. Next is blood flow at the site of absorption. The richer the blood supply, the faster the absorption. That's why an intramuscular injection is usually absorbed faster than a subcutaneous one, because muscles have a better blood supply. Then we have surface area. The greater the surface area, the faster the absorption. That's exactly why the small intestine, with its huge surface area from villi and microvilli, is the main site of drug absorption in the GI tract. Next, drug formulation matters a lot. A drug in solution form is absorbed faster than one in a suspension, and a suspension is absorbed faster than a tablet or capsule, because tablets first need to disintegrate and dissolve before they can be absorbed. Then there's gastric emptying time. Since most absorption happens in the small intestine, the faster the stomach empties its contents into the intestine, the faster the drug gets absorbed. Food can also affect absorption. Sometimes it delays it, sometimes it reduces it, and for a few drugs, food can actually enhance absorption. It really depends on the specific drug. And finally, a very high-yield concept, first-pass metabolism. When you take a drug orally, it gets absorbed from the gut, but before it reaches the systemic circulation, it has to pass through the liver via the portal vein. The liver metabolizes a portion of the drug right there, so less of the active drug actually reaches the bloodstream. This is why oral drugs often need higher doses compared to, say, an IV dose of the same drug. Let's now go through the different routes of administration and how they affect absorption. Oral administration is the most convenient route, but it's subject to first-pass metabolism, and the onset of action is relatively slow. Sublingual and buccal routes. These are great because the drug is absorbed directly into the systemic circulation through the blood vessels under the tongue or in the cheek, completely bypassing the liver and first-pass metabolism. That's why sublingual nitroglycerin works so fast in angina. Rectal administration partially bypasses first-pass metabolism. Not completely, but partially, since only part of the rectal venous drainage bypasses the liver. Intravenous, or IV, administration. This is the gold standard. The drug goes directly into the blood, so there is no absorption phase at all, and bioavailability is 100%. Intramuscular, or IM, injections are absorbed fairly quickly because muscles have a good blood supply. Subcutaneous, or SC, injections are absorbed more slowly than IM, because the blood supply to subcutaneous tissue is less. This is actually useful when we want a sustained, slow release, like with insulin. Inhalation gives very rapid absorption because the lungs have a huge surface area and rich blood supply. Plus, it bypasses first-pass metabolism. And transdermal administration, through skin patches, gives slow and sustained absorption over a long period, and also bypasses first-pass metabolism. Thanks for watching the video. Please like and subscribe to the channel.